It gives me great pleasure to be talking to Anita Tucker, Associate Professor in the Harvard Business School, an expert on processes, Marvin Bower Fellow. And Anita's going to talk to us about how nurses can be more efficient.
Great, thank you. I've studied hospital nurses, basically following them from the start of the day to the end of the day, Fred. And what was so interesting to me was that they're working really hard all of the time. But if you look closely at what they're doing, 7% of their day, at least from my study, 7% of their day was spent working around poor systems. So not having the materials, the information, the equipment they needed to do their job. So an example, a classic example is, you need to use a pulse oximeter and you can't find it on the unit. So you look in 3 other rooms until you find the pulse oximeter, then you go and you get it. And collectively, all those things add up to a significant amount of time, to about half a patient load. And so it's as if every nurse had an invisible half patient that they had to care for that was taking them away from their real patients.
Right, yeah, I actually have a diagram, a flow diagram of the walking that a nurse is involved. And an average nurse, my understanding, walks about 3 to 3.5 miles a day.
Well, yeah, that's quite a lot. And so in my studies, what's puzzled me is that despite the fact that nurses have to fight so hard to get the supplies they need for their patients, these problems persist in the hospital. And I wondered, why that was. But I think it's at least 2 reasons. So one reason is that the nurse, him or herself, might not recognize it, because ultimately they're able to get what they need and care for the patient. So they actually feel successful because you were able to provide the care that the patient needed, and they're really good at reprioritizing. So they shuffle around what they have to do so that all of the major tasks get done, and what they end up not being able to do during that day are things that aren't going to kill a patient. And so there's no visible negative outcome to these things, other than the nurse had to work really hard and some things had to drop off the day.
But speaking of negative outcomes, doesn't that kind of multitasking lead to increased incidence of errors?
Yeah, so we have a paper that hypothesizes that it could. I don't know that there's been any clear evidence, although there was some really interesting research done that showed that it's the minor errors in surgery that collectively add up and lead to something happening, because they're harder for people to compensate for. So I think that there is also a risk of when you're having to remember 3 different things for 5 different patients. So this patient, I'm waiting on B to happen before I can continue with that patient's care. And then another patient over here, I was in the middle of doing something when I got interrupted because I didn't have the medicine, so I'm calling and waiting for that to come up from pharmacy. All of those sort of contingencies and remembering increase the cognitive workload, which then could lead to mistakes and errors.
Now, how can nurses prevent having to do workarounds? What's the solution to this problem?
Yeah, so that was, I think, tied in with the second reason why I think they persist in hospitals, and that's because senior managers are often unaware of the frequency with which these things happen and the actual negative impact that they're having, both on the nurses from a burnout and staff turnover standpoint, as well as the implications for patient care. And so I think nurses need to recognize, first of all, that they're part of a system, and that they have a responsibility not just to their patients today, but to the patients they're going to have next week. And if they know where the breakdowns in the system are, voicing those so that they can get fixed, or at least people are aware of them. But I think the way that you talk about them is important, because you don't want to be labeled as a complainer and a whiner. So it's along the lines of voicing, here's the situation that's making it hard for me to care for the patients, and what can we do so that it doesn't keep happening again next week?
Right, yeah, I agree. I think the key is to focus on improving patient care, and all administrators want to improve patient care, as do nurses, as do physicians. So that is a common goal that we all have.
Yes, I think that's true.
Right. Thank you.
Thank you. Welcome.